Now we're going to be doing a translatory grade 1 and 2 ankle inversion joint mob. The purpose of a joint mob is to increase the joint play or to increase the mobility of the joint, and to also reduce joint pain and to reduce muscle guarding. So some of the effects of joint mobs is to stimulate the mechanoreceptors to help it relax, and to produce and move around the synovial fluid in the joint, and to also increase and maintain the tensile strength of both the ligaments and the tendons around the joint itself. Okay, so I have made sure my hands in my area are clean. The patient is positioned supine with the foot hanging off the table. That way I can better able manage the foot and it's not inhibited by anything. The first thing you do before any type of joint move, you want to find talus neutral and then measure the range of motion. So the way you find talus neutral is you put your finger or your hand on either side of the talus and then move the foot between inversion and eversion until you feel it fully disappear. And that will be your talus neutral. After that, we want to measure her inversion. That way we have a baseline of where we started, and then we can better determine if she's had any increase or decrease after the joint move. Stationary arm is going to be in line with the crest of the tibia, and the movement arm is going to be in line with the second toe. The axis of the goniometer is going to be right over the talus at talus neutral. Again, find talus neutral just to make sure your axis is in the right spot. Then measure inversion. And then that measurement will need to be recorded so you have it for your soap note. Grade 1 translatory joint move is just distraction. So you distract for at least 10 seconds. And this is just to separate the two articulating surfaces, and this is to decrease pain. One hand grasping the fibula and the tibia firmly. And since my hand is a bit smaller, I need to grab her foot this way. Some people are able to do it this way, but to get a better grip, I need to do it this way. Find talus neutral, hold it there, and then distract. You don't need a very big distraction. How are you, Savannah? Good. Is there any pain? Okay. Always check with your patient. Make sure there's no pain or anything. Distract for 10 seconds and then let go. It is a very slight distraction. You're not trying to yank the foot off. For a grade 2 translatory joint move, this is where we're actually moving the joint to increase joint play. Joint play is the available motion that you have in between the two articular surfaces. You distract just like in grade 1 for 7 to 10 seconds, for 10 seconds. And then since we're increasing inversion, we are going to glide the foot towards the tibia or towards her left side. Just say towards the tibia just to make it easier. And we will do the translatory move. You'll move it and hold it there for 7 to 10 seconds for pain. And if you're increasing joint play, 6 to 30 seconds for stretch. Again, distract for 10 seconds. Lateral glide or towards the tibia. Is that okay? You feel it moving? Okay. Always want to check in with your patient to make sure it's not hurting. 7 to 10 seconds for pain, and then 6 to 30 seconds for stretching. And we're just going to end it